Thank you everybody for joining tonight. This is the District 5 United meeting. District 5 United strives to improve the quality of life in East San Jose, and towards that end holds meetings regularly, and that's tonight's meeting. First, I'll just read the agenda. We'll have a presentation on county homelessness efforts and COVID-19 updates by Supervisor Cindy Chavez.
Great. Well, thanks everyone. And I'm delighted to be with you, and happy St. Patrick's Day for those of you who are celebrating. I have on with me both Paul Murphy and Scott Strickland. And so what we wanted to make sure we could touch on was two issues that we wanted to follow up on. One is COVID-19, and the other is how we're addressing homelessness. So what I would like to do, Paul, if I could start with you, have you maybe run through a few of the slides, and that way I could be around to answer some questions, if that's all right. Juan, if we could do COVID, answer some questions, and then do homelessness, if that works for you.
Yes, absolutely.
Okay, great. Go ahead, Paul.
Sure. So these are some slides that were presented by the county administration, and they're helpful. They were most recently presented on Monday night at the Health and Racial Equity Task Force that Councilmember Carrasco and Supervisor Chavez share. And this first slide shows the case counts, and you can see that the case counts are down significantly. There's been 3 surges of the COVID pandemic, and we're recovering right now from the most recent one as the cases go down, but they are still there and still something for us to be mindful of moving forward. And then if I go to the next slide, this is a slide that's talking about the availability of vaccines. And as it says, the allocations aren't meeting our capacity. So the county has the ability to just give a lot more vaccine than we're able to administer right now. So very few first dose appointments are being made right now. The focus is on the second doses for people that have had their first dose to make sure they get their second dose. There are some ongoing concerns regarding Blue Shield's role, and they're the entity that the governor and the state are presenting as a third-party administrator. And recently, the state directed 40% of the vaccines to 400 zip codes, and Santa Clara County was not included. That was really about the way that the calculations were made, and that was disappointing to us, because we felt like we had many census tracts and areas that really could have benefited from that vaccine. We go to the next slide, and this is a really important one because the Johnson & Johnson vaccine has now begun to be shipped. The county did receive its first set of these, but we did not receive any in the second week when they were provided. But as you can see, the Johnson & Johnson, the other 2 vaccines, are 100% protection against hospitalization and death. And as you probably know, the Johnson & Johnson has the advantage, especially for someone like me that does not like needles, that you only have to receive that vaccine once and you're done. This is a slide that has a lot of information in it, but it really just shows what I had mentioned earlier, that the county continues to receive vaccine from the state. And although we received a little bit more last week compared to the week before, it wasn't enough for us to give all those first doses that we'd like to expand to, and we've needed to focus on providing second dosages to people. Here's some statistics that shows even with the reduced amount of vaccine that we're getting, we have made progress. And you can see at the bottom that 63% of residents age 65 have received at least 1 dose in the county, and almost 67% of residents 75 and older have received at least 1 dose. Then you see that top one because there were younger people that have been entered into the eligibility as a nature of their work or where they are and other things like that. This is a slide that has some hopeful news to it, which I think we all can use in our day. And it shows that the deaths and cases in long-term care facilities have gone down just dramatically. And that's a result of prioritizing those locations. The county kind of having strike teams when there was an outbreak to send people there to vaccinate not only the residents, but the staff. And we've seen the progress that's evident from this slide. The next slide is about closing the gaps and shows the many ways that the county is trying to get vaccine to the most vulnerable people in the east side of San Jose and the South County. So there are pop-up sites that are happening. We did go down and do a vaccination for farm workers, and that effort's ongoing. And then we're trying to prioritize the highest need census tracts. And I think almost 100 people are going door to door, knocking on doors and talking to people, trying to get them to sign up and for their vaccination, and explaining and answering any questions they may have about the vaccines. I do want to add here that it's also important that we all continue to get tested, because that's an important part of us addressing the pandemic as well. There have been some priority appointments that are set up, and we're looking to deliver those to people, again, in the most vulnerable areas in the East Side and San Jose. We're trying to address misinformation and myths about the vaccines and the virus as well through these door-to-door efforts. Just a couple other things that I'll highlight from this slide. As we said, we are going door-to-door, and there are big sites opening, like the Eastridge site at the roller rink that's been open now, but we're limited in our ability to provide first doses by the amount of vaccine that we're being provided every week by the state. And this is just an example, the last slide that was provided by the administration, of those targeted appointment dates. And as the vaccine became less, we had to take a pause from that. But my understanding is those have started in a very limited way again. And that's the slides that I have, and I'll now pass it back over to Supervisor Chavez.
Thanks, Paul. And I'll ask one. If we want to take questions now, I'd love to answer them.
Just want to note that I think the entire community appreciates the efforts of Supervisor Chavez in trying to get us more vaccines that we need for the hardest hit communities.
And I really appreciate Angel being here too, just to say how much we appreciate the partnership we've had with Councilmember Carrasco and the Equity Task Force. They've been amazing. All right, so is there still a roller rink at Eastridge? There is, Megan, and it's called the Aloha Rink. And when this is all over, I'm going to be having a community party there. They've been amazing. And Rosalinda, is there a projected date for more vaccines? The federal government has said that there would be more vaccines coming to all of our communities by mid-April to the end of April. And so right now, what they're really trying to do is get as many vaccines to the states as possible and really pushing us to make sure we're getting the vaccines into the community. Why has the county not informed the public about the vaccine reactions do many people that people have had? That's a really good question, Mary. We have notified folks that there is a risk, and there will continue to do that. In terms of doing that in a more organized way, part of the reason I think we've not focused quite so much on that is that we've really been focused on getting people to take the vaccines because we know they're more health protective. And then will we share the PowerPoint? Absolutely. We'll send it to Juan, and you can get it out to anyone you like. And the other thing that I would just encourage you to do is that if you're cleaning the house or you're going for a long walk, you can go to the county's website, and we can actually, I'll ask Paul to put it in the chat, but every 2 weeks the board has a hearing about COVID-19, and it usually starts around 1 o'clock. It's long, it's in depth, but if you're really interested in learning more, you can. And if you're interested in being a community ambassador, meaning you want to learn more and want to help other people learn more, Paul will also put his email in the chat, and we're happy to sign you up to help us with that. Are we going to follow the guidelines set by the CDC? I think we mostly have been. I think we are tied to following the guidelines of the state relative to who can be vaccinated. I have colleagues younger than me in other states who are getting vaccinated, and why do we seem to be lacking in California? Great question. I think one reason is that we're not getting enough vaccines relative to our population. I think the other is that not all of the states are using guidelines relative to health risks. Ernest Gonzalez, senior apartments by Ellen Rock Transit Center vaccinated with Johnson & Johnson. Great, that's good to know. Some Latinos are scared about being reported to ICE or deported if they get vaccinated. Aside from door-to-door efforts to quell these concerns, are there other efforts to reassure individuals? So one of the things that we're doing is that we're putting a lot of information out in multiple languages, Spanish and Vietnamese. And the other is by going door to door. It allows us to help people sign up in real time. And we think that is going to make it, lower the bar for access so far. And the other thing is we're having the locations and places that people feel safe and comfortable, like Mexican Heritage Plaza, Emmanuel Baptist Church, and also the Aloha Skating Rink, because many of us go to Eastridge. Is there any information on how much vaccine the county may receive in the coming weeks, and can we expect more soon? Oh, okay, Paul, I'll let you type an answer there. What is the county doing to shut down the scaremongering about vaccines? So what we're really doing, Catherine, and if you want to help, is and I think you've actually participated in some of the trainings, but we're training individuals in our community to know as much about COVID-19 as they possibly can. So when people are talking to you, they're reaching out to somebody who is a trusted source. We've done the training in English, Spanish, in collaboration with Council members Carrasco and Armendariz from Gilroy. And with those trainings, we think doing that in Spanish, English, and Vietnamese, that we're doing our very best to get out in the community. In addition, one of my colleagues and I have requested additional resources, and we're putting another $1 million into communication so that we can do a better job of making sure people know all the information they need to make sure that they're able to keep themselves and their families safe and aren't fearful of the vaccines. All right. With that, I'm going to turn it back over so that we can make sure that we can dive into the housing piece. And I just will apologize. I do need to leave a little before 7, but Scott will be here to answer questions. And that is because I'm have a meeting tonight with the governor's office because we're advocating for more vaccines.